The National Institute for Communicable Diseases has reported that 13,246 new COVID-19 cases have been identified in the last 24 hours. It says the number of positive results out of the total daily tests increased to 21.7% nationally. And according to the NICD, Gauteng recorded the highest number of positive cases at 7,859. Earlier we spoke to Chriselda Lewis. She's at the Alexandra Community Centre, a vaccination site in Johannesburg, about the latest there.
Gauteng recording the highest ever number of infections on Wednesday at 7,859. This entering uncharted territory, with third wave now exceeding first and second wave peaks and still rising. Desiree, the third wave of hospitalizations are also now about to exceed previous peaks. A total number of 4,420 people are currently hospitalized in public and private facilities here in the province. So last week we saw some COVID wards at hospitals were full, while others were nearing capacity. In terms of vaccination, as of yesterday, over 500,400 people had been registered on the electronic data system, and close to 500,000 people had been vaccinated as of yesterday. And experts are basically saying that it's our behavior now that's going to determine exactly how far this goes. You'd recall, Desiree, over the past few days, we've also been visiting quite a number of hospitals, both public as well as private, who indicated that some of the wards, the COVID wards at their facilities had been full, and some had been nearing about 60% capacity. So the picture had basically been painted over the past couple of weeks about the situation that we're in at the moment. Certainly great concern for Gauteng at this particular point in terms of how it's going to deal with the rising number of infections, but continuous calls for South Africans to heed to these non-pharmaceutical interventions. You know, of course, that Gauteng remains the epicenter at the moment. Lots of movement, of course, because of the kind of the economic hub that Gauteng is. A lot of movement is, of course, quite expected, but at this particular rate, a lot of calls are being made for people to really adhere to those protocols. That would be a way, perhaps, in which to stave off the kind of figures that we're seeing at the moment. So essentially what the province has now done also to try and fast track the vaccination process. You'd recall that right in the beginning, government had essentially said that you have to register on that electronic data system before coming to a facility such as this for your vaccination. So what is happening now is that this is one of the walk-in facilities where, when you are 60 and over, you are able to come to this facility, get registered here, and then you'll be able to get your vaccination. So I guess this is part of the plan to try and fast-track the vaccination program, which has really been criticized in South Africa as very slow. Let's try and find out now what those walk-in means and whether these institutions will be able to manage those numbers in terms of influx. Sister Tabisile Mota is the one in charge at this particular facility. Sister Mota, we appreciate your time this morning. Gauteng deciding now, of course, that you will accept walk-ins. Are we seeing quite a number of those walk-ins here in Alexandra?
Yes, we are seeing a high volume of walk-ins who are coming for the vaccine. They are both registered. Some of them, they are not registered. However, we don't send them back. We do register. As you see, my colleague behind me is busy registering them. We register and vaccinate them, although we don't encourage them not to register on the system before they come, but we do vaccinate them. We further would like to encourage the community to continue with the hands washing to promote hygiene for 20 minutes and to continue wearing their mask and to maintain the social distancing as well. Thank you.
And I mean, what does this mean for this particular community? Alexandra, quite vast. It's a huge area that you have to service. Is this not putting a little bit of strain on you as health workers? Because it's not just those individuals now who are registered, but also those who have not registered who are also coming to the facility. I see there is quite a long line outside.
Yes, we do. It does. We do experience some strain on it. However, we're still managing to vaccinate everyone who present into the facility. We don't send anyone back.
Is there a particular target, Sister Mota, in terms of how many people you're vaccinating on a daily basis here in Alex?
We have as much stock as possible that we can vaccinate everyone who presented here, although the numbers have come down because there are other vaccination sites that are open of late. We don't vaccinate as high volumes as before. However, yes, we vaccinating around 200 per day as compared to the close to 500 that we were vaccinating before in the early weeks.
Sister Mota, we appreciate your time. Thank you very much. You would see there behind me, Desiree, we can let you go, ma'am. I know you're extremely busy. Thanks indeed for your time. Sister Mota, in charge of this facility here in Alexandra, at the Alexandra Community Centre. This is one of those walk-in sites, Desiree, where you would see that, there are quite a number of people here behind me. The sisters who are here behind me with those tablets are registering some of those walk-in South Africans at this particular stage. I'm not going to disturb them much. Quite a lot of work being done here behind me, Desiree, but I'll certainly speak to them when I do get the opportunity to do so. And I think this is part, Desiree, of those efforts to try and fast-track this process, and especially with Gauteng being the epicenter, just over the last 24 hours, recording over 7,000 cases, South Africa over 13,000, and if you look at the number of hospitalizations as well in the province that have really increased, we've seen that over the past couple of days, visiting both private and public healthcare facilities, a great cause for concern, which I think the Gauteng authorities are going to have to try and see where they will be able to tighten measures to ensure that there is a high level of compliance.